43 counties aren't getting extra vaccines this week, and it's their own decision. These are the highlighted counties. You can see none are in central Iowa. They are in rural areas mostly. Joining us from one of those counties is Hamilton County Public Health Director Shelby Kruna. So Shelby, thank you so much for being here.
Thank you for having me.
So why the decision to decline a shipment of the COVID-19 vaccines for this week?
Yes, in our county, we've noticed that there was a slowing of vaccine appointments. People just weren't making the appointments like they had in the past weeks. So we did some asking around, and my clerical staff realized that 4 weeks from today is graduation in our county. So we really felt that that impacted this particular week in importance of getting the vaccine. People are trying to schedule around certain events. It's not that they don't want the vaccine. We're finding that they still really want the vaccine, but they don't want that second dose on Mother's Day or on Memorial Day or on graduation weekend.
So people are starting to get a little strategic about it, it sounds. So how many vaccines typically are you guys using in a week?
Typically, our allocation is 300 doses. And like I said, up until this week, we were able to utilize all 300 doses very quickly. This week, not so much, but so we only accepted 100 of our 300 doses. And we will continue to monitor that every week from now on.
And we have heard from other counties, especially in rural counties, that there is some hesitancy, maybe some reluctance within their populations about the vaccines. Are you experiencing any of that with the folks you serve?
We've done a couple pop-up clinics in very targeted communities. We're trying to spend more time doing pre-education and education within pockets of our county and in Webster City in particular. With some of our Hispanic and our Laotian populations. So we see a little bit of hesitancy, but we're hoping that with this pre-work that we're doing, that in a few weeks, they'll be willing to accept those vaccines.
I guess I want to know, what is it that you're seeing in people that's making them hesitant, and then how do you specifically combat that? What's the message that you're trying to give to people?
Our message is that the vaccine is safe, and it's important for your community, and for your elders, especially in the Laotian community. We're finding probably our biggest barrier is accessing Laotian interpreters. We have a few in our community. We have some very outstanding leaders in those communities, and we're trying to educate them first and then let them educate the rest of their community.
Very nice. Do you expect that you will keep this lower demand going, or do you think that you'll eventually have to start accepting more of those doses when people start picking up again?
Well, I would hope we'll be able to accept more. In May, we're going to be doing some additional outreach to our doctor's offices and getting them some vaccine allocation to them, so they'll have it when somebody comes in for the doctor's appointments. We're really hoping that Hy-Vee and CVS, Thrifty White, that are in our communities will also see an uptick. I think once people realize that it's available at more places than just our mass clinics, we might see some more increase in vaccine. We're at 32%, which is pretty good for right now, but I know we need to get higher than that.
Well, Shelby Kruna, we appreciate your time, and we also appreciate the work you are doing to bring this vaccine to the people in your county who really want it.
Well, thank you.